Good morning, Dr. Lai. How are you?
Good.
Good. Nice to see you. Glad to have you here. I'm
Thank
glad.
you for having me.
Absolutely. I want to say good morning, everyone. Welcome to Lifestyle Medicine for Lower Extremity Care, powered by LER Expo. A big thanks goes out to Dr. Zheng Yu Lai and his wife, Mei Ping Liu, for helping organize this awesome conference. I'd also like to special thank you to Veg Fund, Walk with the Doc, Lifestyle Medical, and the Physicians Committee for Responsible Medicine for their involvement in putting together this groundbreaking event. My name is Rich Dubin. I'm the founder and publisher of Lower Extremity Review magazine and the CEO of LER Expo. I've been in the lower extremity space for over 30 years, and I'm just so honored to be facilitating this awesome educational event. So before we begin, I'd love to know where everyone's from. Just key down in the chat in the lower right where you're from. Let us know. One of the cool things, obviously, about this world we're living in is we can attend these events from anywhere in the world. So I see, hi, Christine, nice to see you. I wish I was in St. Augustine at this particular moment. I'm sure Jang does as well. And we're dealing with snow and very cold weather. Welcome, Ralph, Middletown. Hey, Glenn, Josh, Santa Cruz, that's a nice place to be as well. Keep them coming. Keep letting us know where you're from. And just wanted to go over a couple of housekeeping items for those that have never been on an LER Expo event. So you see the chat feature. Obviously, if you want to ask some questions, hi, Jennifer, Miami. I go down there quite often. Ready to go in a week, actually. Get out of the Northeast. So the chat feature, obviously. Then we have, you want to see who's in the room, you click people, and then you'll get a list of everybody's in the room. You can wave to your colleagues. You can say hello. You can chat with them behind. I encourage that as well. If you do get a message, you'll see in the upper right-hand corner a little number. Right now I have a 2. You'll have some messages from some of your colleagues. And then the 3 emojis. Those are important because those let the speaker know how well they're doing. So if Dr. Liu says, or Dr. Lai says something funny, obviously click on the laugh out loud. And if he's inspiring you and enlightening you, click on the on that light bulb, and then obviously clapping. If you wish to ask a question, there will be a Q&A after the session, about a 10-minute Q&A or so. And you can always grab the microphone and come up to the stage and ask your question in person. I encourage that. It keeps the engagement high, keeps us to see who you are, and that's a really important factor. So that's really it from my side. We're looking to make this a great event. We need your involvement. Engaged learners obviously learn more, and LER is learn, engage, and retain. So let's get this party started. I'd like to introduce Zheng Yu Lai. Dr. Lai is a practicing podiatrist and founder of the Rochester Clinic. So I'm going to turn it over to you, Dr. Lai.
Thank you. Okay, let me share my slide. Oh. Wait. Wait. I have trouble with my sharing.
Okay, lower left-hand corner.
Okay. Sorry.
That's all right.
Yep.
We'll get you there.
Okay.
See, perfect. All right, take it away. I'll see you in a little bit.
Thank you. Good morning. Dr. Lai. I'm in Rochester, Minnesota. Today I'm going to talk about lifestyle medicine in podiatry. I first learned of lifestyle medicine in 2013 when our family doctor introduced this concept to us, and I have found it very inspirational and enhanced my clinical outcome, my treatment outcome. So that's something I want to share with everyone. So today I want to talk about lifestyle medicine and what common conditions that will affect lower extremity, and also how we can do the whole person lifestyle medicine approach in managing common lower extremity conditions. So I will start with the current healthcare system. When you look at the healthcare expenditure in the U.S., we spend about $12,000 per capita, which is 3 times the average of other developed countries. And the forecast is the healthcare expenditure will be close to 20% of our GDP by 2025. It really depends on which study you see. Some have shown that we crossed 20% already. So what does it mean to us? Now, current health system, the 80% healthcare costs are in chronic conditions, and 80% of chronic conditions are really lifestyle related. And because of this, we have more patients who need care, and we have less time for patients because we only have 8 hours a day that we can really work. And at the same time, since healthcare expenditures are getting higher and higher, we are getting less reimbursement, and that's everything we deal with every day or every year. And the one way it has been becoming is we start to specialize. We actually over specialize. We try to do just one area at a time. So we think that we can take care of patient in the time we have. And that's increasing needs for services because more and more patients conditions they are related to chronic diseases. And because there's more patients to see, we have less reimbursements. And what it really leads to is the burnout of the providers. So why lifestyle medicine approach is a good approach? Lifestyle medicine approach is a whole person care. We don't want to just focus on one thing or one area. If you look at our website, we put down that we see you, not a disease. It's the whole person we're dealing with. It's not just the foot or just a plantar fasciitis or just a wound. And we identify and treat the root cause using a lifestyle medicine approach. And in this approach, it involves a lot of education. We talk to the patient to let them know what to do, why they have to do a certain way we want, and we empower them. They have to take charge of the care. They're the one who is going to direct the care. They're the one who really execute the treatment plan. And at the same time, we teach them self-care to really reduce our own work. And we want to prevent any future diseases. So what is lifestyle medicine? According to the American College of Lifestyle Medicine is the use of evidence-based lifestyle therapeutic intervention, including whole food, dominant eating pattern, regular physical activities, really sleep, stress management, avoid risky substances, and positive social connections as a primary modality delivered by clinicians trained and certified in this specialty to prevent, treat, and often reverse chronic disease. And that's their official definition. And I have to mention that it's really evidence-based lifestyle practice. And in 2020, lifestyle medicine has been recognized by American Medical Association as a specialty. And that's why there's a board certification and really train and certify the physicians in other providers in this area. And to me, lifestyle medicine essentially is just treating the root cause by examining and making lifestyle adjustments instead of managing symptoms with medication. That's my own simple version of the definition. So the pillar of a healthy lifestyle is a plant-based nutrition, physical activity, stress management, social connection. When you look at our logo, it's basically the 6 pillars we emphasize. Right here is a plant-based nutrition. We have the physical activities, stress management, social connection. It looks like a Pringle, but it is a 2 people there. It's a social connection. You have a good sleep. You have the passion. Now, passion is not part of the ACOM pillars, but we strongly believe in passion, and I'll talk about that later. And avoid the risky substance as ACOM has mentioned. Dr. Van Dysinger, after me, will go into detail of the 6 pillars. And Dr. Dysinger is also one of the founding members of American College of Lifestyle Medicine and current president of the American Board of Lifestyle Medicine. So he will be a very good resource to reach out if you want to learn more about lifestyle medicine or any board certification. So lower extremity health is important in overall wellness. To us, it's very obvious. As simple as walking. I want to talk about walking is because it's the most popular physical activity among adults, and there's no special clothes, equipment, and it's free. Later today, Dr. Sepgard is the founder of the Walk with a Doc. He will go into more details on the benefits of walking, and also Dr. Loomis, because we treat a lot of sports medicine. Dr. Loomis will discuss how to better recover from a sports injury or just a sports training. But today I'm just going to talk about walking in general. There are a lot of hormones that are related to walking. Cortisol, which is related to which is stress hormone, it will release endorphins that make us feel good. They also produce epinephrine, which is related to fat metabolism. It will release serotonin, which is important in the emotional and cognitive health. It will increase testosterone, which is also related to fat metabolism, and that's related to the mood. So benefits of walking. It can lower the risk of high blood pressure and heart disease because the circulation and also the cortisol. It will reduce the blood pressure level, particularly after meals. Remember, muscle is the largest organ that use glucose. So by using the muscles, you really reduce the blood sugar level, especially after a meal. It will strengthen the bones and muscles. Bones health is really important when we have a direct impact on the bones. It's part of walking. It's not too vigorous, but it's providing the essential forces for the bone health. It will reduce the stress, improve our mood, improve our appetite, and also our sleep quality. So how would the walking and lifestyle medicine pair together? When you walk, you really improve your appetite. And something about the appetite is when you are having a normal appetite, good nutrition, you pick your food. It's more of the healthy food that you can pick. And when you are lack of sleep and you have the craving, you tend to eat food that is more salty, sweet, and greasy. And it will move into the physical activity, obviously, is a part of physical activity, and it will reduce the stress and improve your mood. And it's a social connection. A lot of people like to walk alone, but a lot of time you see people that walk as a group, as pair. That's really a good time to improve the social connection. And it also improve your sleep. When you walk, you reduce your stress, and it really can help you sleep better. And passion is some people just really walk with some passion. So, how the common chronic conditions affect lower extremity? That's something we deal with every day. Now we see people with diabetes, with obesity, with vascular disease, and venous issues, and dementia. A lot of time with dementia, they just walk all the time, excessive walking, and put a lot of stress on their feet. And I want to talk about some common conditions that we can treat with the lifestyle medicine approach. Plantar fasciitis, heel pain, diabetes, or osteoarthritis. Heel pain, we all know, heel pain is the most common complaint in the podiatry clinic. Mostly we see them with plantar fasciitis, we have the heel spur, bursitis, or Achilles issue. Plantar fasciitis is really just information of the plantar fascia. This is something we have to keep in mind. It's really just is information. And what we look at the treatment, we usually look at their lower extremity structures. We look at their activity. We look at their footwear and look at their weight. Weight is another issue. So when we look at the biomechanics, we look look at this Achilles tendon and we look at the plantar fascia all connected together. And aggravating factors, we will look at their activity levels, overweight, obesity. During walking, we put 1 time of body weight on each foot. When running, is at least 3 times. And how they will help with our body, Chuck Carroll today at noon will talk about his own experience, how this weight reduce a lot of problems or cause a lot of problems, and doing the weight management just by reducing weight and how much improvement he can reach and we can do. So for the treatment plan, we really just start from assess and treat the structural issues. When we talk about assess and treat the structural issues, we are not talking about just the foot. Remember, a lifestyle medicine approach is really a whole person approach. You want to look beyond just that foot. Look at the leg and think about their thigh, their lower back issue. That is really whole person approach you have to look for. And then look at their shoes, whether there's a brace, insoles, custom orthotics. You look at the lifestyle adjustments. So when we look at the lifestyle medicine approach in treating plantar fasciitis, you look at the nutrition. Remember, plantar fasciitis or heel pain is inflammation. We want to avoid inflammatory and increase anti-inflammatory foods. Their activity is stretching exercise for lower extremity. A lot of time, people don't stretch even when they exercise. They don't really stretch. I have even yoga instructor who didn't stretch her feet. So that's something that they don't usually remember or they ignore. That's something we need to look at them. And stress management, cortisol really disrupt the balance between inflammatory and anti-inflammatory processes. So stress management, reducing the cortisol is very important. Sleep. Tissue repair occurs in the deep sleep stages 3 and 4. So the body literally repairs itself, but it's during the sleep. So it's not only how long they sleep, it's also the quality of their sleep. So that is something we can address. So when we look at the plant-based nutrition, as I mentioned, we wanna avoid the pro-inflammatory foods such as refined carbohydrates, dairy, alcoholic beverage, gluten. A lot of people avoid gluten because inflammation. I don't want to include gluten here because it's really related. It's important in the mental health issue. So I usually recommend that to avoid the refined carbohydrates and avoid dairies and also alcohols. You want to eat more anti-inflammatory foods such as dark leafy greens, berries, that especially blueberries, that the berries. Plant-based protein is good. Is one of the biggest advantage of a plant-based protein is it doesn't come with saturated fat because we deal with peripheral vascular disease already. We don't want saturated fat that will further compromise the circulation. And you also have micronutrients for collagen synthesis. For collagen maturation, you need vitamin C, you need zinc and copper. And though those will be plentiful from a plant-based diet, you have obviously have a lot of vitamin C's. You can have a lot of zinc from the seeds, like pumpkin seeds, hemp seed, and same as copper, which is plentiful in the dark leafy green vegetable. Physical activity, we stress on the stretching. As we mentioned, that is a whole person approach. Remember that the heel, the plantar fascia connected to the Achilles tendon. A lot of time patients only stretch their foot. That's good, but when you look at the whole person, you really want them to stretch not only the foot, but also the leg and the entire lower extremity that can provide better treatment outcome. Stress management. Cortisol, again, is disrupt the balance between the inflammatory and anti-inflammatory process. You go into the detail of their stress. Sometimes they will tell you things that you didn't think about their life. There's just so much stress at that time. No matter what we do with their high stress level, it's really hard to cut down the information. As I mentioned, sleep, tissue repairs happen in sleep, deep sleep stages. Talk about that. That's one of the biggest issues in current lifestyle is the sleeping. People lack of sleep or they don't have a very quality of sleep. They wake up frequently or because of computer or the cell phone, they don't have a very good sleep. So you want to make sure they go through their sleep cycle, help them have a not only good long sleep but also a deep sleep. They can repair the tissues, they can reduce the stress, and also you can have the appetite control. Remember, when they are hungry, when they are lack of sleep, they're easy to have the food craving, and they crave for the salty food and sweet food. So social connection is really the support. When they have the pain, a lot of time they don't want to go out. That's something that a social support will help them get them going. Go out, just have some walk, relax, like that. Passion is a motivation. A lot of time we look at a patient and we think about why they don't want to do whatever we ask them to. A lot of time it comes down to motivation. They just not motivated to do anything. And the best way for them to do is talk about their passion, what they like to do the most, what they want to do. A lot of time the passion is very simple. For example, one time I had a patient with diabetic foot ulcer, and he didn't want to do anything until one day he told me that he found his passion and he really want to heal the wound so he could do the things he liked to do. And turns out the thing he likes to do was just buying all the return items from Amazon, the whole crate, and then he will come back and find it and resell them. And that's his passion. And that's as simple as that. I look at it, but no, that's a way to motivate him. And I just need to work with him and motivate him to do the treatment. And then the next one is diabetic foot ulcer. I want to mention diabetic foot ulcers is a big issue in our daily practice. Right now, diabetes is the eighth leading cause of death in U.S. 11% of the U.S. population has diabetes, and almost 40% has prediabetes. And as we all know, 15% of patients with diabetes will have foot ulcer, which is the number one cause of non-traumatic amputations in U.S. right now. And 34% of the patients with diabetes, they have 34% of chance of getting a foot ulcer. And so that causes really to the 120,000 non-traumatic amputation in U.S. every year. And what's more scary, as we all know, 50% amputation patients will go further amputation within 2 years. And if you look at it, actually, it's another 2 years that the mortality rate is very high. And why they have the diabetic foot ulcer? Diabetes reduces their immunity, and that also creates advanced glycation that modifies protein that cause neuropathy. That you have the poor circulation, you have dry skin. Also, the soft tissue properties are changed, and then they lead to ulceration and the amputation. So, how do we address this? That we really want to avoid this. So, according to this from Dr. Armstrong's publication, whenever they have an amputation, the 5-year mortality rate is actually higher than having cancer in general. So when we look at standard of care wound management, we want to diagnose and treat the infection. We want to look at the vascular status. We offload the pressure. We want to promote a good wound healing environment, regular evaluation, and manage systemic comorbidities. So in the lifestyle medicine approach, we look at the nutrition. It's a micronutrient for wound healing. Again, we want the plant-based protein that without saturated fat, increase anti-inflammatory food, berry, nuts, and good fats. Walking is tolerated with appropriate offloading, or you want to make sure that the stretch, even the upper body exercise, they will increase their circulation. So it's not that a lot of time we think about they have foot ulcer, they shouldn't do anything. Stress management. There have been studies that patients with chronic wounds have higher incidence of depression. So stress management is a very big part of mental health also. So remember, cortisol disrupt the balance between the inflammatory and anti-inflammatory processes. So proper stress management with the patient will be important. Social connections support with the chronic wounds that tend to be isolated. So it's very important to make sure that they have their social network. I'm sorry, on that. Again, sleep is very important. Tissue repair in that time and motivation. Have to talk about their passion and motivate them so they can do the treatment to heal the wound. So right now we all make sure I'm sure that we all do the comprehensive diabetic foot exam. We look at their bone structure, we look at their skin, circulation, nerve, and check their footwear, and also we do the foot imprints to document pressure points, and that's what we do routinely. And we look at we do the CDFE. Is either yearly or every 6 months, 6 months, or every 1 to 3 months, depending on their risk and our finding. And so that's how we do the diabetic prevention. Right now, besides CDFE, their daily inspection, we have the remote monitoring insoles. But the question is, why we prevent the diabetic foot ulcer when they have diabetes? Why not we prevent diabetic foot ulcer by preventing or reversing diabetes? So there, according to a study in 2020, that meta-analysis of 16 studies with over 1.1 million participants in multiple countries. They look at the lifestyle factors, look at the smoking, alcohol, physical activities, diet, and body fat. So when they look at people with the so-called healthiest lifestyle, just not smoking, amount of alcohol, adequate physical activities, low BMI, low body fat, but predominantly plant-based diet, they have 75% lower risk of diabetes compared to people with the least healthy lifestyle. So just by changing their lifestyle alone, we can reduce the risk of diabetes, and that will be the foundation of preventing a diabetic foot ulcer. And then I want to go into the patient compliance. We will talk about it, touch it a little bit previously. Patient compliance. What do we do when the patient is not compliant with the treatment plan? We usually just say why people don't do it. It doesn't heal or doesn't improve because patient are not compliant. But why? Why they're not compliant? Do we really think about these questions? The number one I mentioned is passion. That is their motivation. If they're motivated, they don't do it. But do we consider other things like social determinants of health? If they don't have a regular housing, they need to worry about where they stay at that night. They're not able to do. They have no idea or no mood to change their own health. Food, nutrition is important, but if they don't have food to eat, it's really hard to talk about plant-based nutrition or proper nutrition. Our clinic, as my wife has a nonprofit organization, Lotus Health Foundation, and she has a community garden right next to my clinic. So for our patients who who don't know what to eat or how to get the proper nutrition, or they just cannot afford to buy food, we have vegetables, foods for them when they leave. They can go out to pick anything, or they can pick from our basket that we have picked already. So that the food security is one that we should be asking, addressing. Transportation, patient miss appointments. Maybe they just cannot have transportation. They don't have car. They live in a place that without public transportation. So, and then utilities. If they are not able to pay for their utilities, they are not going to pay for anything else. Personal safety, if they are not safe at home, or they are not safe in general, other food issue or any health issue is secondary. So that is something that we don't really ask. So podiatry and chronic disease. Chronic disease affect patients in daily podiatry practice. We allow patients to adopt and maintain a healthy lifestyle. And podiatry is frequently the first specialty to notice chronic diseases. Just checking their pulses every time we see them, we can see whether there's a circulation issue. When we look at them, a lot of time they don't even know they have diabetes until you found out, you notice that they have neuropathy. So a lot of time we're the first line to really notice the chronic diseases. And there are a lot of things that we don't really get into it. For example, when we talk about diabetic neuropathy, right now there are vendors supplying the supplements to us to sell to patients. When you look at it, one of the ingredients is vitamin B12. People don't usually think about vitamin B12 deficiency because they think that's only happening in people who are vegan people, because they don't eat meat. But B12 is not produced by animals. Vitamin B12 is actually produced by bacteria in the soil. In the old days, the cows in the pasture, they'll eat grass and pick out the bacteria and have vitamin B12 stored in their muscles. And right now, since they are all mostly in a factory farm, they don't go out to get in touch with soil. And the farmers actually need to add vitamin B12 to their feed. So that's number one. So B12 is really not coming from the meat. And secondly, if you remember the physiology, B12, when it's ingested, it has to bind to intrinsic factor in the stomach. And with this intrinsic factor that protect them going through the intestinal tract, and it will be then absorbed in the distal small intestine, the ileum area, and then stored in the liver. So intrinsic factor is, if any patient there who are taking the proton inhibitor, that means their stomach is not producing intrinsic factor. That means even you give them B12 supplement, their body cannot really absorb the B12. And then when you look at the liver in the storage, we usually say B12 is stored in the body up to 2 years, depending on which study you read. But it's stored in the liver. And right now, it's estimated that up to 1/3 of the U.S. population have fatty liver. That means their liver is not functioning properly. That means they're prone to have diabetes, high cholesterol, everything, but their body doesn't really store B12. So that is something that even we wanna give them vitamin B12 to for the diabetic neuropathy, but their body cannot absorb it. So that is something we want to pay attention to. It's not just we give them, we want to make sure that their body can absorb it, and the medication or the supplement or vitamins can really be absorbed and function. So it's something like that we don't usually pay attention to. So another thing we want to mention is we really promote the community wellness with the lifestyle medicine approach. We have an annual symposium, so anyone is interested. That is my presentation, pretty short and sweet.
Definitely short and sweet. Thank you, Dr. Lai. Very, very informative. Covered a lot of really, really important topics for sure as we relate to podiatry and any specialty for that matter. Incorporating the entire pillars into your patient discussions, I think helps enhance patient care and obviously improves outcomes.
Right. So it is the first time that we introduce this topic. So I try to make a very general overview and leave more time for the Q&A to see anyone have any questions.
Absolutely. Absolutely. So Angeline said, what's your opinion on having a glass of red wine for dinner every night?
Oh, that's very controversial. I don't know how many people are familiar with the Blue Zones, the Blue Zone projects. So it used to be, the research used to say that up to two drinks a day for men and 1 drink a day for women are okay. However, if you look at the WHO, World Health Organization, carcinogen classification, wine is category 1, meaning that's proven carcinogen in human. There's something. And last year, some research articles from UK saying that there's no safe limit for alcohol in human consumption. So I don't think. Why I lost it?
You're good. I see you. I hear you and I see you.
I lost the connection.
I hear you and see you. Yeah.
I don't see myself. Sorry.
Okay.
So
Okay.
I would not recommend 1 glass of wine every day. You can get the same benefits by eating grapes and having a good exercise, because the best we can see is the alcohol itself can increase the HDL, which can be achieved by doing exercise. So we can get the same benefits by doing exercise, eating grapes, instead of having the risk of cancer from the alcohol.
Okay.
Okay.
Dr. Green,
Yeah,
Dr. Green asked, can we rely on lab values?
That's what I really recommend is exercise instead of that.
Okay. Can you hear me, Jen?
Any other questions?
Yeah. Can you hear me?
Because
Can you hear me?
For some reason, mine's just right.
Okay. So we'll get him right back.
Okay. Did you hear what I say?
You will need to reach out. Need to see my account.
We have a lot of questions coming in.
Is May muted?
Grab the mic.
Okay, well.
Okay. Can you hear me?
Yeah. All right. So May's going to grab the mic. Okay, perfect.
No,
problem.
Because for some reason.
Okay, there you are. Okay, perfect. That's fine.
For some reason, my whole website just disappeared.
Okay. All right. So Dr. Green asked, can we rely on lab values for accurate vitamin B12, given that lots of people are on PPIs and have a fatty liver disease? Can you trust the lab report for vitamin B12?
I do the B12 test regularly, and vitamin B12 is one of very few vitamins I take. I don't think we will get enough from the food, so I take the B12 supplements.
Do you trust the lab report on that?
That's debatable. But I do go by the lab. You can if you have the access to multiple labs, so you just send the lab to them and compare and find the one you can trust the most and just keep using that one.
Okay. How does lifestyle medicine change the way you treat patients compared to the traditional practice? And normally, what type of response do you receive from your patients? Oh, now I'm back over here. What happened? Jane?
Yeah.
For
We lost
some reason,
again.
we lost it again.
Yeah. It might be that 2 feet of snow you have there in Rochester, or the one
1 foot only.
the
It's
one
2 feet
1 foot only.
forecasted, only 1 foot.
1 foot only. We should be happy about that, and probably
Yes.
the 1 degree weather that you're working with, might
Right,
be
right.
increasing the
It's-
connection.
Instead of -8, we have 1, so it's pretty warm. So I used to just any practice, so I see patients, so 5 minutes, 10 minutes, 15 minutes, so that's about it. But after I adopt this lifestyle medicine approach, I spend a lot more time with patients. It's the old way. I remember when I was a student, we used to spend a lot of time with patients, but we spend less time. But now I spend more time with patients. For example, my new patient is at least 45 minutes. For our family medicine, is 1 hour. I have 45. Follow up is at least minutes because there's a lot of time to talk to them about their lifestyle. There's uh, you look at the different aspect, and I have a lot more positive results. Especially we talk about the plantar fasciitis, diabetes. Patient get better results because I'm not just treating one thing. I look at the root cause, and I don't need to give them a lot of medication. And in terms of patient response, initially I have a lot of patients that never return. Just after the first visit, because I didn't want to prescribe them medication or I didn't want to do the injection right away. And they just feel like I didn't want to give them whatever they wanted and they go to different providers. But now I have a lot of patients who came specifically because they know I use a lifestyle medicine approach. They have been taking a lot of medication already, or they don't want to take any medication, or they have been dealing with the same issue um, for several years with multiple providers because everyone has the same protocol. Now you give them medication only. You don't really address what's causing their problem.
Does methylated form of B12 help with absorption? Dr. Kraft was asking that question.
Yeah, so you really want to look at the vitamin B12. It's really the sublingual. So you put underneath the tongue and you absorb to your bloodstream directly, and it can bypass the GI system. So that's the one for patients who are taking the proton inhibitor that you want to give them. And that's the same for I take myself too. No, I want to make sure I can just go through the bloodstream and bypass GI.
Okay. Dr. Holt asked, do you give specific dietary recommendations to patients based on their condition, whether it be plantar fasciitis, rheumatoid arthritis, or diabetes?
The principle is the same. It's a plant-based because when we deal with the inflammation, immunity, it's the same thing. We want to have the anti-inflammatory food and increase. We want an anti-inflammatory and reduce the pro-inflammatory food. That's the same. But the difference will be what we are addressing. For example, if there's a wound, we want to have a lot more protein, and we want to make sure we have enough the vitamin C, zinc, copper for the collagen synthesis and tissue regeneration. So the difference is more of the micronutrient side, not a general guideline.
Okay. How about synthetic B1, betaphetamine, right? Benaphetamine, along with the B12. Dr. Horsley asked.
But for the vitamin B, usually we concern about the B12, 40, 40S, and B1. But even if it's synthetic, to me, it's not a big issue. The one we more the natural one is the omega. So that's the one I look for. But the synthetic vitamin B will be okay.
Marty Chalfin asked, what's your current thought on coffee intake?
I'm a little bit biased because I drink coffee.
Me too.
But it's black coffee.
Yep, me too.
No sugar. If I put any cream, it's plant-based cream.
Okay.
So no dairy,
Gotcha.
but mostly black.
Let's see. Aline is here. What is the dose of daily vitamin B12 supplement for adults and children?
It's really based on their initial lab. So I don't usually provide them any vitamin supplements until I do a lab.
Okay.
Yeah.
Jody Smith asked, she's very interested in nutritional management and this holistic approach. Do you have a recommendation for a training program in line with that?
I'm sorry, I didn't hear that.
So Jody Smith asked if there was a recommendation for any type of training program in nutritional management and the holistic approach.
Yes. I don't know whether Dr. Janelle Green is here. She's finishing up a plant-based nutrition certificate. And so there's a lot of training in plant-based nutrition.
Okay. Yeah, Janelle was on. She was here at the event, I think. Correct?
Yeah, I thought I saw her.
Yeah, I thought I saw her as well. Yes. You want to grab the mic, Janelle, Dr. Green? Come on up and. Oh, here we go. Oh yeah, Janelle. So Janelle asked, how do you bill for the time spent with the patient? Is it just the EM code, or are there other ways to bill for nutritional lifestyle component?
It's EM code.
EM code.
For some reason, you don't want to put down nutrition consult. Insurance doesn't like that.
They don't like that.
Right. So everything's the EM.
Even though they can help the patient, they don't want to cover it.
Right.
Saves them money and they don't want to cover it.
Right.
More case for moving toward a direct care practice.
Right. And I also built in the group visit. So right now, a lot of primary care providers, they do the group visit. Mm-hmm. And I do that in podiatry once in a while.
Okay. Do we have any additional questions for Dr. Lai? Dr. Green, did you just completed a plant-based nutrition? What the heck just happened? What the heck just happened? We must be freezing here too. I don't know what's happening. Holy tamale. That must have been what happened to you, Dr. Lai.
Right.
We have freezing temperatures here as well. Okay, good. Well, they can see us in here. So, what are your feelings regarding stevia as a sugar substitute?
It actually desensitizes our taste. And when it goes through our brain will tell us to eat more because it's desensitized our nerve. So it actually increases weight gain because it increases the appetite. So I don't recommend the sugar substitute at all. And for the when you do the lifestyle changes with patient with diabetes, we also use the continuous glucose monitor, CGM, and they can really see the changes from their food, from their activity, and they motivate them and educate them on the importance of lifestyle.
Dr. Mabo, she missed the billing side. Basically, Dr. Mabo, Dr. Lai said that he bills under an EM code, and occasionally you'll use the group code as well.
Well, group visit is also the EM
Okay.
code, but then instead of just one patient, you bill to your capacity, 4, 5, 6, or even 10 patients in a group, and you are able to bill roughly 9213 for 5 to 10 patients in one session.
Yeah, you can't bill a nutritional code. The insurance doesn't like that. Yeah.
Right.
Yeah.
Right.
That's what Dr. Holt said, for sure. So do we have any additional questions for Dr. Lai? Did I miss the answer to nutritional training? Well, we were trying. There's a number of courses, Jody, on nutritional training, and I believe from what Dr. Lai was saying, Dr. Green had just completed a course. So maybe, right? Is that correct?
Yeah, she will be. She's
doing it now. So what course is that, Dr. Lai?
I don't know what one she takes, but I know there's a few. There's one out of Cornell. That is the most popular one. And there are a few plant-based nutrition conferences. There's one in DC every year, and another one in California.
PCRM.
In the DC is PCRM.
PCRM.
Physician Committees for Responsible Medicine.
Dr. Lumi will present.
And this from Dr. Lumi's organization. He'll be presenting.
And he'll be presenting later today, Jody. So I'm sure there'll be some additional information and some of the other courses on what opportunities there are for learning. Is there a board certification for lifestyle medicine? Dr. Lai?
Yes.
Okay.
Yes, I am. I'm certified. As I mentioned, Dr. Dysinger is the current president of the American Board of Lifestyle Medicine.
He's actually on next, correct?
Right, yep. He's next. And I talked to him. I asked him to mention a little bit about board certification. So awesome. We'll see.
What are your thoughts on intermittent fasting?
It's very important.
Very good college.
Very beneficial.
Okay. That's good. That's what I do.
Good. Yeah, intermittent fasting. Dr. Dysinger is actually an expert in fasting. Oh, wow. He can have a whole lecture on the fasting alone, so he's a very good source too.
That's fantastic. If we don't have any more questions, you guys can take a 5-minute stretch break before Dr. Dysinger comes on, unless you have another question for Dr. Lai and his lovely wife, May, in the back there.
But she doesn't have the headphone because I have those. You can ask her anything about cooking.
Great. Oh, yeah.
You want a delicious plant-based food, you need to talk to her.
Absolutely.
And that's another reason I still need to lose weight because I eat too much.
For sure. Hey, listen, you make good. Anything tastes good, right? Right around with the right amount of seasoning, done it properly. Any reading on fasting? Marty, they said it's tremendously beneficial. There's tremendous health benefits, ketosis and autophagy and all the things that your body actually goes through when you're fasting. I've done a little bit of research on that, Jeng. So, it's very, very, very a lot of health benefits. That's a good question. What are the best foods to break the fast?
I'm sorry.
What are your best foods to break? What are the best foods to break your fast?
Carbohydrate. Okay. Compressed carbohydrate. we're not talking about the refined. So for example, my breakfast every day normally is raw oats with sweet potato,
Okay.
and then you sprinkle on top the hemp seed, pumpkin seeds, stuff
Cinnamon,
like that.
a little cinnamon.
Yeah, you can.
Awesome. Well, I've learned a lot. I'm grateful for you, grateful for what you're bringing to the profession. I'm excited that we've included you on the agenda for next week's event. We're doing the No Nonsense Podiatry Seminar next week. It's a 3-day event, 25 CME, and we've included a session on lifestyle medicine for that event. So I'm very excited that you'll be a part of that as well, Dr. Lai.
Good.
And thanks for the session. You got about 4 minutes. I'm going to close out of this session. We got about 4 minutes until the next session with Dr. Deisinger, and I look forward to seeing you all in there. All right, have a good one. Take care.